You're watching NBC4. Live from the area's leading news station, this is News 4 at 11.
Some news for your health tonight on a biopsy breakthrough. When doctors find a suspicious tumor or growth, waiting for the test results can be awful. But now a new kind of imaging is giving patients instant answers.
When the result came back that I had a rather large polyp and of the type that can become cancerous, of course I was really concerned.
Finding out that you might have cancer is alarming news for anyone, but for 66-year-old Eric Zanat, that polyp in his colon was especially worrisome.
My dad died of colorectal cancer, and he was only 72, but he was diagnosed at about the same age that this polyp appeared in me.
After doctors removed the growth, Zanat waited days before he could find out the results of a biopsy. He didn't have cancer, as it turned out, but he would need to come back in 3 months. He says he wasn't looking forward to a second biopsy.
You're waiting for the results, you're hoping for the best, but each day they don't come, and it takes a week or so, and of course, you don't call it trauma, but you do call it concern.
But when he went in for the next test, Zanat got a pleasant surprise. Doctors used a new device, and they were able to tell him that day that there was no more precancerous tissue left. He was in the clear, and he didn't have to undergo another biopsy.
Usually when we see something during endoscopy, we have to take a biopsy, send it to the lab, and then talk to the patient after a week or so and tell them what the results are. Here we can immediately look at the tissue, see what it looks like.
Georgetown University Hospital gastroenterologist Dr. Firas Alkawaz is using a new device called Cellvizio. It's a flexible microscope inserted into the body during routine procedures like colonoscopies. The scope can magnify tissue up to 1,000 times, allowing physicians to instantly detect whether there are any cancerous or precancerous cells.
So here we can decide immediately if we need to do something, sample more, treat more, take it out.
That can save patients from unnecessary procedures and the stress of waiting for test results.
Knowing this all right at the time is great for one's mind, and also great to find out you don't have to go back in.
Eric Zanat still needs to be screened regularly, but for now, he's resting a little easier.
You feel better. Any thoughts of dying too young disappear, at least for a while.
Right now, doctors are using Cellvizio to look at growths along the GI tract, including the stomach and esophagus. They hope to be able to start using it in other areas of the body, including the lungs.